I practice in the southwest suburbs out of Christ and New Lenox. Many of you might want to know why an interventional cardiologist wants to do anything with prevention. I have a very bad family history. No males live past 62. On my mom's side, everybody's diabetic by 40. I turned diabetic at 38. I've done 6 Chicago marathons and 9 Olympic distance triathlons, so it's not because I don't exercise. So my family history caught up with me. So I really got into lipids, and then I started looking into prevention of strokes for AFib, became a speaker for Janssen. So I'm going to keep this real quick as possible. I was told 25 minutes, usually it's an hour, but we'll get through it. I'll try to leave it very clinical, and then I'll take questions at the end. So there are 6 indications for Xarelto, and by the way, Janssen is actually sponsoring your dinner tonight, so all the food you're having is being paid for by Janssen. So if you haven't signed the sheet, none of us want to go to jail. So please sign in with either Bernard or David, who are at the back of the room. That'd be great. So, going the wrong direction. There we go. So there's 6 indications for Xarelto, and the top one you'll notice is non-valvular AFib. Oftentimes I get asked about what non-valvular is defined as. You cannot use this drug in moderate or severe mitral stenosis or mechanical valves. Those are absolute no-nos. Most of us see a lot of moderate or severe mitral stenosis. I volunteer in India. The hospital I volunteer at does 7 mitral valvuloplasties a day. In this country, we treat strep throat, and therefore we don't see much rheumatic disease. The 20 milligram dose is for a creatinine clearance greater than 50. The 15 to 50 milligram, or 15 to 50 creatinine clearance has a 15 milligram once daily dosing. Many of you know that you have to give it with food. You absorb about 55% without food and about 83% with food. Please do not use GFR and creatinine clearance interchangeably. There is an eGFR app that you can download for iPhone or Android, and it's the 4th formula down, Krakow Galt. And please use creatinine clearance for any of the newer anticoagulants. Second indication down, you'll see it was the first one that was approved for DVT and PE treatment. There is no creatinine clearance correction for dosing. It's creatinine clearance greater than 30. It's 15 milligrams twice daily, followed by, for 21 days, followed by 20 milligrams once daily. Now, the question that I asked when I saw this is many of you know Eliquis dosed their higher dose for 7 days, and it made me ask why. So what we know is Janssen did 21 days at the higher dose for recurrent events. There was a significant drop-off in recurrent events by day 18, day 19. What Eliquis did is they did daily ultrasounds of the leg and found that thrombus burden significantly decreased by day 7. To me, clinical recurrence or clinical events are probably more important than daily ultrasounds, which is not clinically relevant, but we don't do that in our practice. So this slide should really draw a lot of attention. Many of you know that Eliquis had a special population label for end-stage renal disease. And Xarelto got the same exact label in June of this year. The clearance between the 2 drugs is only about 9% difference. The 27% clearance with Eliquis is actually 50% of the bioavailable dose. The dosing for Xarelto in end-stage renal disease is 15 milligrams daily. Just remember there's no outcomes data with end-stage renal disease. It's purely pharmacokinetic. The same as with Eliquis. And then when you look at the actual section, this is the section 8.7, and it's identical in its special population label as Eliquis. So this black box warning is there for premature discontinuation. The most common question that you'll ever get in your clinical practice is when to stop the drug before surgery. And the label says 24 hours, and then 48 hours for brain or spine surgery. So please do not go longer than that because you're putting yourself at risk for liability. And if you do need to go longer than that, please bridge with Lovenox. Spinal epidural hematoma warning. This is there with all anticoagulants, whether it's Lovenox, Plavix, Effient, and basically you hold the drug for 48 hours if you're going to actually do a back injection or spinal surgery. So let's talk a little bit about non-valvular AFib. You'll see that this is a busy slide, but the bottom right, the one-year mortality for an AFib-related stroke is 63%, so 2/3 die at 1 year. There was a very elegant Annals of Internal Medicine paper written about 3 years ago, looking at the average number of falls it would take for one brain bleed. And it kind of surprised me. It was 296 falls for one brain bleed. It got me thinking along with this number that we're not being aggressive enough for anticoagulation. And that those patients that fall maybe once or twice a year may or should be anticoagulated with the consent of the patient and the family. So you'll notice that we're not doing a very good job of anticoagulation. If you look at the chart on the left here, these are patients without